Hello, in this session, I'll be dealing about placement of vaccines in the ice-lined refrigerator. So what are the specific learning objectives of this session? First, you should be able to correctly place the vaccines in an ice-lined refrigerator, and you should also be able to list which are the freeze sensitive and the heat sensitive vaccines which are available under the Universal Immunization Program. So for this, I have classified the entire presentation as to heat sensitive and light sensitive vaccines. Then you have freeze sensitive vaccines and placement of the ILR vaccines in the ILR. So what are heat sensitive vaccines? As you know, there are vaccines which are under the immunization program which need to be transported between 2 to 8 degrees centigrade. They are monitored very strictly because they will lose their potency. So with respect to heat sensitivity, some vaccines become useless if they are exposed to heat. So let us look at the vaccines which are available under the immunization program from the least sensitive to the most sensitive with respect to heat sensitivity first. So the two common vaccines which are heat sensitive, the most heat sensitive are BCG vaccine after reconstitution and OPV vaccine. So that's why when we are going to the vaccination session sites, you see that these two vaccines are placed in the holes which are available in the ice packs. Then comes rotavirus. This has to also have to be kept in the space which is provided within the cold ice packs. Also, measles rubella vaccine and JE. Next is the T series vaccine, which have almost similar heat sensitivity. That means they are not very sensitive to heat exposure. So you have the DPT, TD, pentavalent, and last is the hepatitis B, which is most heat stable or least sensitive with respect to heat. So how do we identify light sensitive vaccines? A very easy way to identify light sensitive vaccines is to see which are the vaccines which are coming in a very dark colored ampule. There are only two vaccines which are coming as dark colored ampule. Which are they? First one is BCG vaccine. Okay, this is also a reconstituted vaccine. The second one is measles rubella vaccine or a measles containing vaccine. Both of them, as you can see, are dark in colored ampules. If this is clear, let us go to the next concept of freeze sensitive vaccines. As you can see that the temperatures need to be monitored for a vaccine between 2 to 8. It doesn't mean that we freeze a vaccine. And for that, we need to know what are freeze sensitive vaccines. So I will take you through the freeze sensitivity of the vaccines from the least sensitive to the most sensitive with respect to freeze sensitivity. The least is BCG, especially after it has been reconstituted. Next is OPV, then you have rotavirus, MR, and JE. So these are placed very close to the bottom of the ILR, as you can see it in the next section. However, the ones which contain T, like DPT, pentavalent, TD, and hepatitis B, are more sensitive to freezing, and that's why they are kept above baskets of the ILR. See, an easy way to remember it, all the ones which contain T, of course, other than hepatitis B, have to be kept in the higher baskets of the ILR just below the diluents, whereas the non-T containing vaccines need to be kept in the uh, bottommost rung of the ILR, but care should be taken not to freeze them also. So with that, we will come to the correct placement of vaccines in ILR. We can divide the entire ILR into the ILR into vaccines above the T series and below the T series. So with regards to the correct placement of the ILR, you can see that this is how an ILR looks like. Of course, we will not have such blue and very pretty printed boxes, but we need to arrange the vaccines correctly in the ice-lined refrigerator. And for that, we have to remember the freeze and the heat sensitivity of each of these vaccines. For simplicity's sake, I will make it Very easy for you to understand with few mnemonics which you need to remember to keep the vaccines correctly in the ILR. So the first one is, if we consider all the vaccines above the T series, that is above TD vaccines, this is what it will look like. Hepatitis B, pneumococcal, pentavalent, DPT, IPV and TD. So the mnemonic for this is Himachal Pradesh Physical Director is transferred. So hepatitis B, pentavalent, pneumococcal, DPT, IPV and TD. Himachal Pradesh Physical Director is transferred. The ones to remember below the TB vaccine is rotavirus, then you have BCG, JE, MAR, and OPV. So the mnemonic for this is Rajasthan Blackjack may be old. Rajasthan Blackjack may be old. Let us see that in our Iceland refrigerator. Rotavirus, Rajasthan. BCG, black. JE, Jack. May be measles containing vaccine, which is rubella. And then you have OPV, that is old. So I hope this small video has helped you to understand the mnemonic as well as the heat as well as the freeze sensitive vaccines and the correct placement of these vaccines in the ILR. Thank you.